Welcome Dr. Arloph Johnvieira for the podcast. You are an industry expert and domain expert for pharmaceutical supply chains. So let us start having this conversation. And how do you feel about joining this conversation before we go ahead?
I have been associated with Exim for some time now, and I found the professional approach and the content so very enriching that there is a lot of professionalism in that, and the people who are involved also are of a different level altogether. So that really attracts me to come here.
Okay. And true. And as we discussed offline, to reach youngsters, you need to be innovative, and this is a way of innovation.
Correct.
So you handle the supply chain of Bajaj Healthcare. What are the core competency of the company, and what does your responsibility entail?
Yeah, actually our company is involved with the manufacturing of API. Then after around 10 years we forward integrated into formulation, but we are known to be the largest manufacturers of vitamin C if you ask about Bajaj Healthcare. About my responsibility, I handle end-to-end supply chain activities, which starts from demand, then supply planning, procurement, packaging development, logistics, till the goods reach the customer. That's how I define my role.
Very interesting.
Yeah.
And today, if you see with a lot of youngsters, there is a focus on demand planning and supply chain planning.
Absolutely.
And for India to be a global powerhouse,
supply chain is to be very good.
Why is temperature control so critical in the pharmaceutical logistic chain?
See, actually, there are some products which are temperature sensitive, which means that they are stable in that temperature range only. So for such products, to have the temperature control and to have temperature maintained at that becomes very critical. Otherwise the drug becomes unstable, it loses its potency, and then eventually the desired effect is not availed by the patient. So it's very important to maintain that temperature, because the product needs that temperature because of the stability of the product.
Yeah. So what do pharmaceutical companies expect from their logistics service providers?
See, I will broadly summarize as they require reliability, they require efficiency, they require compliance, and most important is they require agility, that is resilience to any disruptions or anything. Broadly, this four is what any shipper will expect from a freight forwarder or a logistics service provider.
In your wide experience dealing with various service providers, do you find something that they tend to overlook?
To be honest, since I come from the pharma background, there is nothing which a service provider or logistics service provider should ever overlook. But still, if there is one point which I would try to emphasize, is the end-to-end visibility, the tracking, because it's so very important for us to ensure that the product is tracked, monitored at the desired temperature, humidity, and at the real-time basis. That's a key for us.
And I think going forward, technology will play
that
a key
definitely
role.
helps us in doing that. Yeah.
So how do you feel technology is transforming pharmaceutical logistics?
See, in my long career, let me tell you, there were days when we used to keep data loggers, send data loggers, and then even the software we had to send. Today, you have universal data loggers, you have universal, and IoT sensors are there. Then there are certain, SIM card based tracking is happening nowadays. Then you have blockchain to track the whole accounting this. So technology is a big enabler, and especially for high value temperature sensitive cargo, technology is a breakthrough.
Okay. Great, I think very interesting insight from you. How would you describe India's current global standing in the pharmaceutical industry and the potential for growth, especially in the generics?
See, to be honest, India is a pharmacy of the world, and if you really look on a volume terms, we are third largest volume producers of the whole world. Though in value we may be 14th or what, because we make affordable products. But if you really look from a generics point of view, see, the brands, when brand building happens, there's a lot of marketing, sales and marketing expenses, which is around 40%. So when you talk of generics, basically you are reducing the cost of the medicine to nearly 50 to 60%, which means it makes it affordable for the common man, and for middle class, below middle class, and for the below poverty line. Generics is the way forward, at least for a country like ours, which we are still developing, right? So our people need affordable medicines.
Certainly. And I think companies like you all have led the reputation of India also globally on generics. What is your view on the current policies regulating the Indian pharma sector as well as pharmaceutical logistics?
See, government has been pursuing a lot of good policies from the logistics sector as well as from a pharma. Like we have the API parks are there. They are emphasizing that you locally produce the API so that it is bought within. So our dependence on imports is less. There are many logistic infrastructure is being improved. So all in all, there is a big boost from the government of India to really support the pharma sector, because they know even a US put tariffs on everything else, but pharma was exempted because their dependence on India pharma is so well. So India is also pushing and boosting the pharmaceutical manufacturing.
Great. So I think coming to the world today, where there is a lot of chaos, there are geopolitical tensions across. You pinpoint any location on the map, there is some issue going on. So how have they affected the pharma industry? And what strategies are companies adopting to handle this scenario?
See, to be very honest, some scenarios are there. There are two types of problems. One is a controllable and one is beyond your control. These type of things are beyond your control. We hardly can do anything to control them. But how do you react to them? Currently, the impact is the freight cost has gone up, the insurance cost has gone up, the routes have changed. As a result, the freight roundabout routes are very costly. Now the only way is, to be honest, there's a little bit of wait and watch policy going on, and government is also intervening. Lot of meetings with the shippers and other stakeholders are happening to how to deal with the situation, because it is beyond even government of India's control. But the best part is government of India, along with all the stakeholders, including manufacturers, logistics service provider, freight forwarders, shipping liners, they all together as a group, they are really having frequent meetings and trying to see how they can face the situation so that really the impact is the minimum.
And pharmaceutical industry is what has impact across geographies, because medicine is a basic necessity.
Absolutely, there is no continent which has been spared, to be honest. So it has affected the whole world.
Yes.
And luckily for India, at least because of our local manufacturing and there is a lot of things, we are in a better position to equip. But we are so dependent on this international business also. So we are also waiting and watching. There's very little we can do as of now, except monitor the situation closely. Maybe if we can delay some things, not send something, if something is not very urgent, only the life saving or something which is very important, critical, can be sent at higher cost, because you have no option. But those which can be deferred, those which can be delayed, it is better to delay and defer them as of now.
Absolutely.
As a strategy.
Now, I think, Doctor, thank you. You have given some wonderful insights. I gained a lot of knowledge,
It's
and
a
I know
pleasure
this
for
will
me
be
also.
helpful to
It's
a
a
lot
pleasure
of
for
people.
me to share whatever little I know. Thank you so
Great.
much.
Thank you.
Thank you.
Yeah.
Thank you.